Good morning. Firstly, I'd like to give just a brief background on the setting and the service I am discussing this morning. The National Rehabilitation Hospital, NRH, is the National Tertiary Referral Centre in Ireland, providing complex specialist rehabilitation services to patients who, as a result of illness or injury, have acquired a physical or cognitive disability or both. The NRH is the only hospital of its type in Ireland and is fully publicly funded by the Health Service Executive. The role of pre-admission coordinator was established in 2016, specifically for the brain injury and stroke programme. So the hospital recognised the need for a service dedicated to managing access to specialist neurorehabilitation in Ireland. Prior to this, there was no organised system for admitting patients to the brain injury programme. Since the introduction of the pre-admission coordinator, we now use a standardised assessment to identify patients' rehabilitation needs. This allows us to direct patients' care towards the most appropriate rehabilitation service. So some patients will not actually require admission and can be effectively managed through outpatient services. So an example of this would be attending rehabilitation medicine consultant outpatient clinic, or attending vocational assessment service or our specialist outreach service, etc. The remainder of patients are admitted into either a routine rehabilitation bed, which includes the full spectrum of mild, moderate or complex neurodisability, or admission to one of our two subspecialty services, and these are our prolonged disorder of consciousness and our neurobehavioural service. So the brain injury programme consists of 53 beds across 4 wards under the care of 6 rehabilitation medicine consultants. Not all of these are full-time, so 2 full-time consultants and 4 part-time consultants. And we have available to us 2 single rooms for infection control and prevention. Planning admission to the brain injury programme is determined by multiple factors, which are summarised. And these include the patient's chronological waiting time for admission, an assessment of the patient's rehabilitation needs, which includes a detailed biopsychosocial assessment, balanced against available staffing levels. We also have to consider the allocation of beds according to gender. And finally, we assess the patient's infection status to determine if a patient requires one of our 2 isolation rooms. So in order for me to gather all the information I need to fully assess the patient and their needs, engagement with key stakeholders is critical. And this is an example of some of the agencies that I would liaise with on a regular basis. The role of the pre-admission coordinator connects the NRH to patients and their families, to acute hospitals throughout Ireland, to our primary care services and our social care services. The pre-admission coordinator must also engage with stakeholders within the organisation to ensure that risk assessments are completed. So, have there been benefits to the pre-admission coordinator role? Well, yes, we think so. There is now an effective coordinated process across various healthcare settings to facilitate access to specialist neurorehabilitation in Ireland. A Casemix system has been developed to balance admissions of patients of various complexity levels with available staffing. Pre-admission assessments have been found to contribute towards a 56% reduction in unplanned transfers to acute hospitals due to an unexpected medical event. We have seen a 17% reduction in empty bed days due to appropriate patients being identified for admission to available beds. The role has promoted access for patients who require complex rehabilitation, and we do this by redirecting those with less complex needs to alternative rehabilitation services. An example of this was seen in December 2018. 31% of patients were removed from the inpatient waiting list, which reduced the waiting list from 238 to 165. So we feel this is good evidence of effective waiting list management. Okay, so challenges for the service.
Veamos aquí los desafíos para el servicio. No son propios
for specialist neurorehabilitation in Ireland. So we're seeing an increase in the number of referrals that are coming into the hospital. Along with the increase in number, we're also seeing increasing complexity among the patients that are referred to us. So they require, I suppose their needs are more complex and more costly. An ongoing challenge for us is the increasing expectations from families and patients. And this, I suppose, is seen in terms of the expectation for as a rapid access to specialist service, but also in terms of the level of recovery that patients and families are expecting. And another major factor is delayed transfer of care. So this occurs when patients have completed their rehabilitation program, but were unable to discharge them safely from the hospital because they're often awaiting very costly home care packages or placement in an appropriate setting that can manage their complex needs. And unfortunately, while we're waiting for these services to be put into place, that bed then is not available for admission to the next patient. So there's a combination of complexes. Thank you very much.